Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to everyone. Today I would like to share findings from a study titled Does Health Literacy Predict Cognitive Frailty? Cognitive frailty is a clinical condition characterized by simultaneous presence of physical frailty and mild cognitive impairment in an individual without the presence of dementia. CF is a potent key factor for the occurrence of dementia, Alzheimer's disease and other disabilities. Based on the previous study conducted among physically frail and mild cognitive impaired older adults, multi-domain lifestyle intervention consists of cognitive training, physical exercise, psychosocial support, healthy diet and guidelines, as well as vascular management has been proposed as to be an effective intervention for CF population. Previous study conducted has found that age, multimorbidity, lack of social support and low niacin intake to be a risk factor for risk of cognitive frailty. It is crucial to identify the risk factor for CF and it can be crucial in preventive and intervention strategy for this population. Some studies suggested that health literacy to be associated with cognitive impairment or cognitive decline in older adults. Cognitive health literacy is an ability of an individual to seek, understand, and utilize health-related information and required services. Older adults with low health literacy have poorer health-related knowledge, have increased use of healthcare system, they have taken less preventive measures related to the lifestyle, and has higher mortality rate. Previous studies have shown that health literacy has association to the cognitive impairment has predictive can be predictive factor for frailty status in an older adult. The association appear to be independent of age, demographic factors as well as education status. However, despite the association between the cognitive function and health literacy, cognitive status has been treated as exclusion criteria in most of the health literacy related study. Therefore, the level of health literacy and its associated factors among older adults with cognitive frailty need to be explored and further analyzed. This study is part of a larger study under the AGELESS trial project aimed for the reversal of cognitive frailty. This study employed cross-sectional design with multi-purposive sampling method. The sample was selected from two predetermined locality. For urban, we chose older adult from Klang Valley, and for rural, we recruited older adult from Rembau Negeri Sembilan. Older adult were recruited from the list of ageless trial screening. Those older adult age 60 and over, community dwelling and able to understand Malay and English were included into the study, and those who present with condition that may affect the data collection and its quality, such as major depression and sensory problems, were excluded. We collected social demographic details and self-reported medical history from the participant. And as for the health literacy, we used Health Literacy Survey Malaysia Questionnaire Q18, this questionnaire has 3 domains: disease prevention, health promotion, and healthcare domain with 18 items. Participants were to rate each item on 4-point Likert scale, and the total score will range from 0 to 50. Those scored 33 and less will be grouped into limited health literacy, and those scored more than 33 will be grouped into adequate health literacy. For the cognitive frailty status, participants were screened using CDR score as well as the 3 out of 5 criteria. The data collection were conducted through face-to-face interview. So based on the findings, 757 participants who have completed all the questionnaire have been included into the analysis. The mean age of participants was 67.47, and 53% of the participants are female, and majority of them were Malay ethnicity. Out of 757, we found that 289 participants to be screened to have cognitive frailty, and 76.9% of our participants were from urban locality, and more than half of them have at least secondary education. And from the total participant, we found that 68.2% of the older adult has limited health literacy, and out of which 76.5% of older adult with CF fall under the category of limited health literacy. We found that there is significant mean difference in the health literacy index score between the CF and robust group. All the variables which have significant p-value less than 0.05 in the bivariate analysis were included into the binary logistic regression. Age, locality, education level, and limited health literacy were found to be the independent predictor for risk factor for the risk of cognitive frailty. More than half of two-thirds of the older adult with CF has limited health literacy. The mean score was significantly lower in CF population compared to robust. Age, locality, education level, and limited health literacy were found to be independent factor for risk factor for CF. Health literacy risk of CF would improve 0.53% times in older adult with low health literacy. However, the complex and reciprocal relationship between limited health literacy and CF could not be determined from this study. The findings suggest that there is a need for public policy to improve health literacy, as it can be used as a preventive and intervention strategy against CF. It is also suggested to include health literacy assessment, a comprehensive health literacy assessment in the multidimensional geriatric assessment for this population, as this could help to make the health-related information more accessible and understandable and relevant to this particular population. As for the limitation, this is a cross-sectional design, so the cause-effect relationship between the cognitive frailty, risk of cognitive frailty and health literacy could not be determined, and the finding from this study may not be generalized to the general population based on the locality and the ethnicity factor. The future direction, we aim to analyze the data further to understand the area, which is the domains in the healthcare component, in the health literacy component that need more specific attention in CF population to facilitate the intervention and implementation program. So for the conclusion, we know that older adults with CF has limited health literacy, and this limited health literacy may be an independent factor for CF, and this relationship warrants more attention from healthcare providers and policymakers, where intervention to improve health literacy can be proposed as an intervention for CF population. With that, thank you.